Welcome back to the Caregivers podcast. I'm your host, Dr. Mark Ropeleski. You can call me Dr. Mark. Today's episode is more than an explanation. It's a naming ceremony. A naming of a wound many caregivers carry quietly, a wound that isn't burnout, but it's actually moral injury. Burnout has become the default label for any distress in healthcare and caregiving. And over many discussions during my journey, I can recall hearing the collective eye roll around boardroom tables when the words caregiver burnout came up. I suspect that's because of a one-name-fits-all fixed mindset definition, which is totally outdated and needs expansion and deeper discovery of its root causes. But many caregivers, professional or family, aren't just exhausted. They feel something deeper, a quiet erosion of their identity reflected in a fracture of their values. The very same identity and values which shape their calling, or maybe the realization that a job and career in caregiving would be a good fit. If you've been doing all the right things, rest, time off, therapy, self-care, and still feel hollow, if you've ever wondered, maybe the problem isn't me, but maybe it's the system around me, you're in the right place. Today, we're exploring moral distress and moral injury and how these wounds shape caregivers in ways that aren't always visible, but are always felt. So let's begin. Burnout isn't the whole story. We all know the burnout triad of sort of emotional exhaustion and cynicism and a reduced sense of accomplishment. But burnout is real, but here's the problem. Burnout often implies the caregiver just needs to cope better, to toughen up, to remember that others have faced the same before them. But that's not only wrong, it's harmful. Dr. Jenny Byrne cuts through the noise. She says, stop saying burnout and get clear on what the real issue is. The real issue for many caregivers isn't a lack of resilience. It's compounding moral distress, resulting in deeper and deeper moral injury and resulting in pain and distress. So here's the distinction. Burnout's about depleted energy. Moral is about violated values. Burnout says you're tired. Moral injury says you're wounded. And it's not your stamina, your how you show up and your resilience that are wounded. It's your soul. And unless we name that wound correctly, we can't heal it. So what is moral distress? Let's talk about it further. Moral distress is the in-the-moment pain that you feel when you know the right thing to do is standing in front of you, but you just can't do it because the system, a policy, a family conflict, or circumstances beyond your control block you. You know what your patient or loved one needs. You know what the person you care for needs, but time, resources, staffing, or other rules get in the way. And for professional caregivers, it kind of looks like discharging a patient with many social risk factors earlier than feels safe because hospital beds are tight, or rushing an end-of-life conversation because the waiting room is full, delaying treatment because of prior authorization roadblocks or difficult access to the operating room and time in the OR. Filling out documentation during a moment that really deserves actual human presence in front of your patient or the person you care about. Watching social needs like housing, food, trauma go unaddressed while being expected to fix the problem medically. Now, for family caregivers, it might look a bit different. Being judged for decisions you agonize over, feeling like you're failing someone you love so much because you can't make up the difference for what is otherwise neglected or not being offered. Making impossible choices between your health and their needs. Moral distress is emotional whiplash. It's a tightening in the chest and neck and shoulders that affects you every time you move. And it's that uneasiness deep inside of you, that sense that this just isn't right. But when it becomes chronic, persistent, and recurrent, something deeper forms. That deeper thing that forms is moral injury. So what is moral injury? Well, moral injury happens when your values are being violated repeatedly, when you take on, often subconsciously, the burden of it all and feel responsible for outcomes you can't even control, when you're expected to be part of an inflexible system that conflicts with your mission to heal or to look after others, when you're witnessing harm that you can't prevent. It's not burnout's buddy or cousin. It's separate. It's ethical trauma. Dr. Wendy Dean, one of the clearest voices on this topic, writes, moral injury locates to the source of distress, not in a clinician's frailty, but in the conflict-ridden healthcare system. Jenny Byrne describes it even more viscerally as a wound on your soul. Think about that. Burnout says, God, I'm tired. Moral injury says, God, I'm becoming someone I don't even recognize anymore. The signs include shame, guilt, numbness, loss of purpose, irritability, and emotional withdrawal. And underneath it all runs a painful question of oneself. Am I even a good caregiver anymore? The tricky thing is that the isolated experiences may not feel like trauma in the moment, but over time they add up and they erode the core of who you are. You may look fine and busy on the outside. You may hit your productivity targets, but inside something feels fractured. Wellness on the outside, well-mess on the inside. So there is a bit of science behind all this, and I thought maybe we could review it for a sec. See, here's what many people don't realize, is that recurrent ethical conflict doesn't just hurt you emotionally, it actually rewires your brain. And here's what happens in your brain. With constantly reinforced moral injury, the alarm center in our brain goes into overdrive, keeping us on constant alert, scanning for the next crisis. And that part of your brain that actually helps you stay calm and connected to others and yourself with empathy, it actually starts struggling in all of this. Your body floods with stress hormones that just won't turn off. You can't shut them off. They stay elevated and they disrupt your sleep, weakening your immune system and your ability to recover and bounce back. And that brain fog you've been feeling, it's where it comes from. In Jenny Byrne's words, our culture is one of repression and denial. We feel bad inside and we don't know why. But now you know why. And knowing changes everything. So we need to understand a little bit more about the system we work in and how we function. Often when caregivers attempt to give a voice to their inner state, many are told, you're just burned out. Others can handle this workload. Try to be more efficient. You need to toughen up. What could you have done differently in that situation? Maybe you need to take a mindfulness class. How come it just happens to you and only you? This is institutional gaslighting. It makes caregivers doubt their own perception of reality and the actual harm they're experiencing from moral injury. Family caregivers can hear similar messages. You're overreacting. Plenty of people manage this alone. Stop being so emotional. You're probably over-worrying because you're tired. You must have dialed wrong, maybe the wrong number, and misunderstood the instructions. You're just too informed. You don't understand the real picture. As Wendy Dean puts it, when we run our healthcare systems like big businesses, physicians suffer, and so do patients and caregivers. Dr. Robert Pearl, who's written extensively on the topic in his book, Uncaring, and who co-hosts the Fixing Healthcare podcast, would likely agree. And the same is true for every type of caregiver. Gaslighting keeps people quiet and self-doubting, and silence is the perfect soil for moral injury to grow. Lots of impacts occur across caregiving. For professional caregivers, moral injury shows up as detachment, emotional numbness, and general cynicism that really isn't cynicism, it's loss. A loss of our internal compass. A quiet grieving of the caregiver we used to be. Jenny Byrne reminds us clinicians are not light bulbs, they're human beings. Much like light bulbs, caregivers are starting to feel replaceable, and then with a casual flick of a switch, you're likely forgotten. But when the systems we work in treat caregivers as replaceable components, that mismatch truly damages people. Family caregivers carry their own version of this wound, watching someone decline while feeling powerless, feeling guilt for needing rest, striving for perfection and making decisions that don't have an obvious right answer, losing the sense of self, carrying a load for the system that the system doesn't see or accept. And many feel they can't speak openly about it. But your moral injury is real, your distress is valid, and your wound is really worth naming. Naming your wound really matters. This is where the shift begins. Dr. Jenny Byrne says that words matter, and it's really important for us to articulate what we feel inside. And when we mislabel moral injury as burnout, we offer these surface-level solutions to really deep wounds. We blame the individual instead of looking at the system in detail, and we undermine caregivers' legitimate suffering. We hide the true nature of the pain. Naming moral injury doesn't fix the system, but it tells the truth, and the truth is the foundation of healing. And in the right environment, change. So let's talk about some ways to protect ourselves, and I've thought up of 5 of them. You may not be able to fix the system, but you can certainly begin to protect your integrity and restore your sense of agency in the short term until the forces of change take a bigger effect. So number one, let's recognize the early signs by asking ourselves, when did I last feel proud of my work? When did something really feel wrong? When did I compromise my values? Awareness is the first step in healing. Number two, the 4-column journal. In your journal, create 4 columns and describe what happened, why did it feel wrong, what's already in my control the next time, but what more control do I need to reclaim? This simple habit builds clarity and ethical resilience. Number 3, reclaim some micro-agency over yourself. Small actions matter. Protect one encounter each day for real human connection where the whole of you can actually thrive. Redraw boundaries and say no to those roles that drain a sense of purpose out of you and your authenticity. Agency heals powerlessness. Number 4, talk about it. Jenny Byrne reminds us that talking about it, hearing back from a peer, is actually incredibly healing. You don't have to broadcast your pain to the world, but just speak it somewhere safe. Our healing needs witnesses. Our community among caregivers, that's where we are and that's where we need to be. And number 5, use what we call narrative medicine. Tell your story. Don't let the formal name intimidate you. It's simply this. It's writing or speaking about your own story and experiences as a way to process and heal from them. There's healing in storytelling. When you put your experience of how it felt into words, whether it's journaling privately, recording voice memos to yourself, or sharing your story with a trusted friend, you're doing something powerful. You're naming it. You're taking what it feels like, what that chaotic internal feeling is, and you're giving it external shape and form outside of your body. You're actually processing it and making sense of it so you can see it clearly. And when you can, you start feeling that weight lift. It can be short or long, private or shared. The point isn't achieving literary quality, it's honest reflection. So naming your experience externalizes the wound and moves it from inside of you to outside of you, where you can look at it, understand it, and begin to heal it. Forge your story into medicine. Here's what warriors throughout history have always known. The wound that stays silent festers. The wound that's spoken begins to heal. Your experience, the moral battles you've fought, the compromises that cut you, the moments that tried to break your spirit, these deserve to be named. Speak them aloud. Let them pour out however they need to come. Trust me, this isn't about being eloquent. It's about being honest, raw, and real. When you externalize what you've been carrying, when you take it out of your chest and your neck and take it out of your gut and put it into words, you transform from victim to witness, from wounded to warrior. Now, we can't just think of ourselves in isolation. We need to ask what institutions must do in parallel. Now, despite the apparent convenience, caregivers can't heal fully if systems don't change too. Institutions must provide timely ethical debriefing, trauma-informed leadership, and courage. Workflows that respect the humans doing the work and support that goes well beyond organizing caregiver resilience workshops amidst any culture that eats its young. They need policies that acknowledge value conflicts. Caregivers are not the problem. System design is the problem. Moral injury is a design failure. It's not a personal failure. So look, as we close out today's episode, let's think about the following. If anything in this episode resonates with you, well, hear this. You're not broken. You're responding to a broken environment. You don't need more grit. You've got it already. You need truth. You need language. You need community. And this podcast is part of that community, a place to speak openly, to name what hurts, to heal what's been denied, to reclaim yourself while you continue to care for others. Caregivers, heal first. Then we empower, then we transform, then we thrive. Thank you for listening today, and I'll see you in the next episode. Before we wrap up, I wanted to remind you of something important. The conversations you hear on this podcast are here to inform, to support, to spark reflection. They're not a substitute for professional medical advice, care, therapy, or crisis services. Listening to this podcast does not create a doctor-patient or caregiver-client relationship between us. If you're facing a medical concern, health challenge, a mental health challenge, or a caregiving situation that needs guidance, I encourage you to reach out to a qualified professional who knows your story. If you're ever in crisis, please don't wait. Call your local emergency number or recognize crisis hotline right away. You deserve real-time help and support. The views you hear on this show, whether from me or my guests, are our own. They don't necessarily reflect any organizations we work with or are part of or have worked with or been part of in the past. This podcast is an independent production. It's not tied to any hospital, university, or healthcare system. Thank you for being here, for listening, and most of all, for taking the time to care for yourself while you continue to care for others. I look forward to hearing from you.